Hi, Dr. Neil. Let's look at your posterior prep. So let's go through all the different criteria. Proximal clearance is either closed or visibly open at the height of contour. So right here, it's probably closed. Right here, it's visibly open. So I think we talked about maybe trying to bring this out a tiny bit more so you're visibly open on both sides and this side a tiny bit more in. But I think this would still be a pass. And the sub would be that the proximal clearance at the height of contour extends 1 millimeter, but less than 2 millimeters beyond either. So I don't know if this would be a sub right here, possible. So reading the criteria, very carefully, it might be. But I think you just need to center it a bit better. Then gingival clearance is open, but less than 1 millimeter. That's right here. And you have it. Boom, check. Outline form. You have a nice outline form. It's smooth. Now, one of the criteria is outline form is inappropriately overextended, compromising remaining marginal ridge and or cusps. Again, they may get you for that here. If they say that you're compromising this cusp, maybe I would, just bring it in a bit. That's all. So maybe possible another sub there. I mean, this is being very picky, but it might be a sub because it's too far to the lingual here. And then isthmus is perfect, 1 to 2 millimeters in width. That's this. Check. Perfect. Cavosurface margin meets the enamel at 90 degrees. Gingival floor is flat. So we just want to make sure all these angles are sharp, going from your walls to the surface of the tooth. So going up the walls to the surface of the tooth, here to the surface of the tooth, you want to be going at a nice sharp 90 degrees. So you don't want to create a prep that's kind of like this, right? You want to make it a nice boom, boom, boom box. So, which I think you have. You got this. Cavosurface, we got that. Sound tooth structure. Okay, the axial wall depth. Molars. The depth of the axial wall extends beyond the DEJ 1.5. Now, is this the DEJ? If this is the DJ, you're underextended. You still need to go another 0.5 or so. So 1.5. It feels like a lot, and it is. In normal dentistry, this would be a pulp exposure, but that's what they want. So really pay attention to where the DJ is. Is this the DJ? I think it is. So if we consider this to be the DJ's line right here, then you need to go maybe over here, and everything should follow the curvature of the tooth, right? So you don't want, this shape of this box to be different than the outline of the tooth. So we want our box to be coming in, following the outline of the tooth, and then going out like this, more or less. And then this is 1.5. It's really huge. It's a big distance, but that's what they want. Now, for a premolar, it's 1, okay? Molar, 1.5, 1.5, premolar, 1.0. Oops, premolar, 1.0. So pay attention to this distance, measure it, and gently make sure you get there, and then make sure you're following the curvature of the outside of the tooth, so everything is symmetrical with each other. Everything else looks great, doctor. I don't have any other kind of notes on this. I do want to say, again, same like with your anterior, once you reach this point and you want to get modifications, now what I want you to do is to just go with a small round burr, and if there's caries here, only remove the caries, make like little round holes and remove the caries, and then you look at it again If there's undermined enamel, you ask for another modification. Hopefully there's no undermined enamel or pulp exposure or anything, and you can just go ahead to fill. But overall, really good, much better. Things are much bigger than what you would think in some areas and much smaller than what you would think in other areas. Really good job.